So guys, I know I just talked a lot. Believe me, I can feel my mouth getting extremely dry right now, so maybe my voice will sound different when I come back and record this later. But these are some pretty important points, and it speaks to what Hair Chemist says. Sure, clinical settings aren't one-to-one with the real world, because there are so many factors
reality
to take into account.
The clinical setting can often yield a different data set compared to a study that had 100 men.
However, let's actually point out a blind spot rather than concern trolling and saying some BS about people losing their hair and how it's inevitable no matter what they may do, okay? You're not actually showing what's going on, you're just kind of obfuscating things. This perspective will make people not inquire deeply about the causes of their hair loss and even their health, as we know that if you have lichen planopilaris or alopecia areata, these are autoimmune conditions, and as we've stated before, autoimmune conditions seem to be co-occurring. So let's say you have lichen planopilaris and you go get checked and you have Crohn's disease, right? That could also be a possibility. This is why you need to inquire about these things and not have such a huge blind spot. And honestly, I think I'm one of the few people in this space and even in broader academia that's pointing out this blind spot. And, Dr. Paresis and the Hair Chemist, you guys are welcome to join myself and even more so the esteemed Dr. Jeff Donovan in kind of calling this out, right? And joining Dr. Rassman as well. But they're not doing this, right? Dr. Paresis and the Hair Chemist, they don't seem to be interested in pointing something out like this. It's either they don't know or they, for whatever reason, aren't doing it. I'm going to say that they don't know, just to be charitable here. But that is not an excuse for them to just say all this blatant, BS about finasteride and dutasteride, especially when it comes to their efficacy and their safety. So I would say that starting with dutasteride and not finasteride is the meta here. Not only that, but getting a scalp biopsy to learn more about your hair loss makes sense in finding the right treatment for you if you suspect that you don't only have androgenetic alopecia. When you get a scalp biopsy, they take a small bit of tissue out of your scalp, and yes, in doing so, that tissue, that area, you lose some hair follicles, maybe about 40 or 50 hairs, and that area is replaced with scar tissue as the area kind of heals back. But I want to ask you this question before you start freaking out. Don't you think it's useful to sacrifice 40 or 50 hairs to learn about the potential fate of maybe 100,000 or 50,000 hairs on your scalp? Really? Put that into perspective. And if you can't find a dermatologist who's willing to look at this data, I'm sorry, but you're just going to have to find a good one that is willing to accommodate you and actually look at this data. Because really, this is a huge blind spot that not a lot of people are pointing out. It's your health at the end of the day. Learn how to advocate for your health, especially when you go to a doctor.